Hi, good evening. This is Lori Hamrick. This is my strategic plan presentation, a 5-year Arts in Medicine initiative to support Novant Health's mission. Novant's mission is to provide a healthier future and to bring remarkable experiences to life for its patients, staff, and community. The vision and values of the Arts in Medicine initiative would be to embed the therapeutic modalities of art, live therapeutic music, and story authors in Novant's clinical setting, as well as in ambient spaces. By doing this, it would help to support Novant's mission of creating a healthier future, and it would bring definitely remarkable experiences to life. The mission statement for this Arts in Medicine initiative at Novant is to use a clinically embedded program of arts to support Novant's mission to create a healthier future and to bring remarkable experiences to life for those patients, staff, and visitors so that Novant becomes the preferred healthcare provider in these communities. In the first year of the initiative, we will hire ambient musicians, artists, and authors who will practice their craft in public spaces such as main entrances, ED weight rooms, and surgical weight rooms. This will be done on a rotating schedule. This is to ensure that the staff, visitors, and vendors become accustomed to seeing the artists and the musicians in the clinical setting, but it also serves to orient the musicians and art staff to the clinical setting to determine if their interest includes becoming certified to play, create, or write at the bedside for the patients. Having an on-site live therapeutic music training and certification program helps to ensure the efficacy of the consults, the compliance, and the safety of everyone involved. It will be imperative to train the staff and the administration on the differences between art that is performative and therefore entertainment, and therapeutic music, art, and authorship that is designed to reset the parasympathetic nervous system. Live therapeutic music will be included in honor walks for transplant donors, again, to support the transplant donors, the families of the donors, and to embed the musicians into the clinical care teams. In the second year, consults for the arts modalities will be implemented in the electronic medical records for accurate documentation, and the arts and authors on-site training and certification program will begin. In year 3, art and legacy story author consults at the bedside will begin. Year 4 will usher in the option for music and art and their legacy authorship at home care, home hospital, and hospice. And then year 5 will round us out with the beginning of the Novant Community Choir and the Medical Orchestra. Successful societies are dependent on expert analysis in healthcare, education, and leadership, but our current events clearly show a deep distrust in all of those areas. In fact, according to a JAMA Open Network publication in 2024, the patient trust in their healthcare leaders has dropped surreptitiously. There's never been a successful society in the history of the world that didn't include the humanities. Music, art, sculpture, theater, literature, these are all the modalities that hold a mirror before us to show us where we are. They help us to step into someone else's shoes, to be able to experience empathy, connection, and they encourage us to seek out creative solutions to everything from our own emotions to how we interact with others and how we ensure the best outcomes. Studies show that a clinically embedded arts program will help staff, patients, and visitors feel seen, heard, valued, and understood. This is important to Novant as it looks to differentiate itself from its competitors in the market, and it's important to them to be able to attract and to retain the best staff. As we attempt to reconnect with our humanity and regain trust with our patients, the arts is a low cost, high return on investment option. For patients, live therapeutic music at the bedside is complementary, and the soothing sounds help to take a patient from fight, flight, or freeze to rest and digest. A relaxed patient is going to be much more amenable to medical intervention than a patient whose cortisol levels are high. That benefits the staff too. The staff then feel seen, heard, valued, and understood. And the visitors and vendors benefit from the presence of the ambient musicians and the artists playing and creating in the public spaces. The music especially just literally seems to clear the air, and there's a feeling of competence, caring, and empathy as soon as visitors and vendors and staff enter the doors. And legacy story authors create life mission, vision, and values statements for patients that capture the essence of who they are and what that is something that they can then take home with them as a reminder of the remarkable care that the Novant staff have given. According to an article in JAMA in 2024, the trust in healthcare leaders fell from 71.5% in April of 2020 to 40.1% in January of 2024. That is a devastating effect on physicians and healthcare systems' ability to positively influence their patients. It's imperative to rebuild trust, and one of the ways to do that is through the arts. While data and science have unfortunately been an integral part of that erosion, the arts, which were originally a form of medicine in ancient biblical days, has been sidelined to entertainment. However, the intrinsic ability of the arts, especially music, to have a positive effect on heart rate, blood pressure, improved oxygen saturation, and respiration rate remains regardless of the society's belief in it or not. Studies have shown that live therapeutic music can do all of those things. The arts are a way of repairing trust, of attracting staff and improving retainment. There's never been a successful society in the history of the world that didn't include the humanities. Music, art, sculpture, theater, and literature, these are all modalities that hold a mirror before us and show us where we are. They help us to step into the shoes of someone else, to experience empathy, connection, and they encourage us to seek out creative solutions to everything, from our own emotions to how we interact with others and how we ensure the best outcomes. Studies show that a clinically embedded arts program helps staff, patients, and visitors feel seen, heard, valued, and understood. As we attempt to reconnect with our humanity and regain trust with our patients, the arts can be a low-cost, high rate of return option. For patients, live therapeutic music at the bedside is complimentary, it costs them nothing, and the soothing sounds help to take a patient from fight, flight, or freeze to rest and digest. A relaxed patient is going to be much more amenable to medical intervention when they are relaxed. That benefits the staff too. The staff suddenly feels seen, heard, valued, and understood, and they are appreciative. And visitors and vendors benefit from the presence of the ambient musicians playing in the public spaces. The music literally seems to clear the air, and there's a feeling of competence, caring, and empathy as soon as they enter the doors. And legacy story authors create life mission, vision, and values statements for patients that capture the essence of who those patients are so that they have a concrete take home as a reminder of the remarkable care that the Novant staff have given them. The stakeholders needed for the Arts in Medicine initiative are the CEO and others in the C-suite, human resources, the chief compliance officer, nursing governance, the Voices or DEI committee, the Organizational Wellness Committee, and the Novant Board of Trustees. In addition to ensure funding, the Novant Health Foundation will be a key stakeholder. The initiative will require a coordinator for administrative and directive duties, 3 musicians, 1 visual artist, and 1 legacy story author during the first year, with additional funding later for the Novant Community Chorus and Medical Orchestra. Securing budgeting for the initiative will be key to the success of the program, to support Novant's mission and to attract staff, to improve the workforce retainment, and it will help to ensure and rebuild trust between the health system, the physicians, and the patients and community. The initiative budget will support a full-time coordinator, 3 PRN musicians, 1 PRN visual artist, and 1 legacy story author for an equivalent of a $312,000 budget annually. The return on investment will be an endless supply of goodwill, and increased fundraising opportunities will be there for the foundation to tap into, because there are going to be segments of donors who might never fund a capital campaign, but who will consider funding the arts. It will also increase community awareness through the circles of those artists, musicians, and authors. A secondary consideration would be that staff who join in the Novant Chorus or the Medical Orchestra will feel an increased level of engagement, and they're going to be more reticent to leave the organization, since inclusion in those activities will only be for current staff. According to an article in Nursing Administration Quarterly, the cost to replace 1 nurse is averaged to be $56,000, and according to the Mayo Clinic proceedings in 2026, the average cost to replace 1 physician is between $250,000 and $1.3 million. If a Novant chorus or a medical orchestra can dissuade just 1 nurse each year of the initiative and 1 physician each year of the initiative, the savings to the organization will more than pay for itself. The first step to secure buy-in would be to meet with the Novant Foundation CEO to discuss funding. Chances are the foundation will assist in getting face-to-face or virtual meetings with the other key leaders. Once the Arts in Medicine initiative has 1 or 2 key leaders' support, the progression will flow. If the aspired goals of clinical or administrative buy-in don't prove successful, the civic groups and churches can serve to encourage community leverage and support. Once funding is secured, the coordinator will work with IT and nursing leaders to build a consult application into the electronic medical records. This is so that the art staff can receive consults for patients. This is an incredibly important step. It's key to ensure that the arts and medicine staff become an embedded, trusted part of the clinical care teams rather than be viewed as patient distraction or entertainment. By utilizing the Plan, Do, Check, Act course, continuous improvement will result from frequent assessment. Some of the tools used will be medical records reports to discern the appropriate patients for consults, reports of consults that slice and dice, secure chat with nurses to request consults of specific appropriate patients, cross collaboration with other departments, unit rounding, and leadership huddles. Thank you so much for your attention as you listen to my strategic plan for a 5-year arts and medicine initiative at Novant Health.